Okay, well, last week, LDS Hospital opened a new inpatient psychiatric unit, and we have Ted Wander here from LDS Hospital to tell us kind of more about that unit and, more importantly, why there was a greater demand for it in Utah.
Well, thank you. We're very excited to have opened 7 new beds. So our unit went from 27 up to 34 inpatient beds. So it's not a big size increase, but we hope that it's a very big quality increase, and we look forward to serving more patients there.
Ted, let's talk about the need here in our state for this just a second. 1 in 4 Americans are going to experience a diagnosable mental disorder in any given year. 50% of mental health problems appear by age 14?
Yes.
That's young. 75% of all mental health problems occur by age 24. And then this statistic, Utah is ranked 8th in the country on death due to suicide. There's a big need for what you guys are doing there at LDS Hospital.
Yes, depression is a very serious illness and has a 10 to 15% mortality rate. That's a mortality rate that's worse than some cancers. And so depression needs to be treated, and it is treatable. And that's the very good news. That statistic of 8th in the country, I don't want to give the impression that Utah stands alone, in the sense that it really is the entire Intermountain West. So it's Idaho and Montana, Utah and Colorado, New Mexico and Arizona. There's that swath through the Intermountain West that always comes up as the highest rates of suicide in the country.
Wow.
Well, and we were talking kind of behind the scenes about this earlier, and will you tell a little bit about what happened when you went out to talk to ABC in New York?
Well, they had called me in another capacity, and to talk about why there's such high depression rates here in Utah among Mormons, and that just doesn't turn out to be the case. It turns out to be that affiliation with any organized religion will lower your rate of depression, and so being in organized religion actually is protective in some ways against depression.
Do you find a lot of people don't know what's available there at LDS Hospital until you need it? I know that we've been there. My family's used LDS Hospital before for mental health, and it's such a comforting thought once you know it's there to know about it.
That is comforting, but most people are going to be getting their care in outpatient clinics, and of course we're trying to build those services as well.
Good.
But for those who need the stabilization of hospitalization, support in staying safe, more rapid medication changes, a more intensive piece of psychotherapeutic work, then the inpatient unit is the way to go.
Well, and we talked about depression and those sort of mental issues, but another huge thing that's been hitting Utah is all the substance abuse.
Yes, yes. And as we come into the holidays, of course, that's a consideration. And we do detoxification at LDS Hospital, which is not treatment for addiction, but it does get a person ready for addiction treatment. And then we have outpatient services as well at the Day Spring program.
Well, there's also a crisis line.
Yes, there is.
So if you or someone you know needs help right then, that's available as well at LDS. Let's put their information on our screen. We'll also put it on our website in case you need it. But yeah, that's the website, ldshospital.org, and the phone number. Congratulations, though, on your expansion. Just opened last week. So thank you so much for being here. All right, coming up next, if you were asked, would you like more sleep or more sex, what would you answer? We'll tell you.
All right, and coming up later, we got a little furry friend in studio who's looking for a new home. Learn all about him coming up.